Alright, welcome back. Today we're going to talk a bit about how to optimize regenerative medicine procedures like platelet-rich plasma or bone marrow aspirate. And if you're going through these procedures, we really want to make sure that you're going to get the best benefit, the best results. Obviously, the no-brainer is we can't be doing any NSAIDs, no smoking, and we're really going to make sure if there's diabetes present that it's well controlled. Before getting into these 7 ways, this is not intended to be medical advice. This is just general medical information regarding this topic. Number 1, we have vitamin C. Vitamin C plays a significant role in the formation of collagen. So a deficiency in vitamin C could result in a suboptimal collagen formation. So if we're trying to stimulate healing of tendons, ligaments, we want to make sure that this process is optimized. Typically, we have people take 1 to 2 grams once or twice a day. Number 2, we often recommend folks supplement with essential amino acids. Of course, this goes hand in hand with adequate protein intake, and we recommend around 0.75 grams per pound of body weight. Really, these provide the building blocks needed for recovery. If there's any issue with diet, digestion, or absorption, this could result in deficiencies in some of these building blocks. So this is our way of optimizing the available building blocks. Number 3 is aerobic exercise. This plays a role in helping to minimize this lower grade chronic inflammation, improves wound healing, increases blood flow. Movement also facilitates nutrient diffusion, like in joints and in discs. The next is low-level light therapy. We've talked about this a lot on our channel with our red bed. So this can help with wound healing and pain, specifically related to the increased fibroblast proliferation, resulting in increased collagen and elastin synthesis. Number 5, we have hormone levels. We see that low testosterone levels can slow wound healing. We also see that low estrogen levels in females plays a significant role in the development of osteoarthritis. So obviously optimizing these hormone levels can help optimize our outcomes. Next one, hyperbaric oxygen therapy. This one's a little tricky as most of these good quality oxygen chambers are not really accessible. The real robust chambers get the pressure up to 2 to 3 ATMs, and those are the levels where most of the evidence supports wound healing. The cost for those is usually out of the question, and some of these other chambers that are more conducive to costs are just not as effective, or there's not as much research supporting those. Those are those soft oxygen chambers that get up to 1.2, 1.5 ATMs. And lastly, we have peptides. One of these specifically is BPC 157. So there's some good in vitro and animal studies showing this peptide, which is essentially like a small protein or a chain of amino acids, plays a significant role in wound healing. Sadly, there's not a lot of human trials, so it's one that's kind of more in the experimental realm. There's no evidence supporting its use in humans at this point, but it's used commonly in many clinics for this purpose.